Hi everyone, thank you for joining us today and welcome to this online session for those in their first year living with diabetes. I'm Sarah and Mel and Craig are here with me as well, and we're all from the Paediatric Psychology Service. We're going to cover a couple of different things today in this session. We're going to find out how other young people with diabetes have made it work for them. And it's also your opportunity to meet us, put a face to the name and find out how we can help you to get through this big change as well. If you're live, you can ask questions through the question and answer section, and you can also share your thoughts there as well. This is our first time delivering this session online because of the current situation. So there's going to be a link to a feedback form that was sent in your invite, but I'll put it in the Q&A section as well. If you could leave us some feedback, that'd be so helpful. It should only take about 5 minutes and it just helps us to improve on future sessions. So in terms of the Q&A, as I said, you can put your questions or thoughts in at any time. I'll be looking after the Q&A, and there's going to be points throughout the presentation where I will then be able to share your questions with Mel and Craig and kind of get some answers to them. There's also subtitles available in a range of languages, so along the bottom there's an option to select subtitles in the language that you prefer. Everything, including the Q&A, will be available in the recording afterwards, so you can look back over it if you want to. And it's also important to be aware that in that recording, your question and name will be shown. So when you ask a question, you can put whatever name you want. You don't have to put your full name if you don't want to, and you can also ask questions anonymously as well. So I think I've covered all the initial things that we wanted to speak to you about, and I'm going to hand over to Craig.
Hello. So you may recognise the format of these next few slides, but essentially before we wanted to deliver this live event, we wanted to try and capture the voices, experiences and advice from those who have lived experience of diabetes. So we conducted a survey of young people in Northamptonshire who have diabetes. Most of the respondents had had diabetes for more than 3 years, and the survey captured their most common experiences, including their fears and worries, the fears that didn't come true, and any advice they wanted to share with people who are just getting to grips with diabetes. For example, some of you that are watching this video. Coming in at number 10, so 16 out of 31 respondents told us that they were worried about talking diabetes with their friends. What will they think? Will they think differently of me? What if they're mean? What if they don't understand? How will I explain it to them? As an adolescent, you know, being accepted into social groups for many of us feels like a life or death scenario. So the fear of being rejected by our friends can feel enormous. And so it's also something you're just starting to understand yourself. So trying to explain it to someone else might feel tricky. At number 9, what's happening to me? At least half of our respondents told us they experienced mood or behaviour changes that they just couldn't understand. Now, adolescence can be unpredictable enough, and now you've got this whole new thing to try and make sense of. So with changing blood glucose levels, you might notice your behaviour or mood changing throughout the day, but that's okay, and it's something that most people with diabetes will experience at some point. Worries about being unwell. So more than half of our respondents told us that they had some worries about becoming significantly unwell, and it's not surprising because you've suddenly got to take medication and attend hospital for checkups and reviews. That might be a worry that pops into your head, and that's okay. At 7, feeling uncomfortable. So again, more than half of the people we asked felt that the treatment at some point could be uncomfortable. It's new, it's somewhat frightening, it can be something that you've never had to experience before, especially if you're self-administering. So it's no wonder that actually in the beginning this can feel super uncomfortable. Family worries. So more than half again said that at some point their parents or families were worried about diabetes, and they might be more worried than you. and it may be that their worry ramps your worry up too. Typically, we're human and we worry about things that we don't know about, and these worries can be exacerbated by other people too. Those people especially maybe are there to support us and care about us, and they're worried about our safety and our health. It's confusing. So again, loads of people told us they felt confused about how to manage diabetes. There's a lot to learn in the early stages, and it's a completely alien concept to so many that it can probably feel quite overwhelming. There's so much you've got to start counting things, paying attention to the food that you're eating. It's new. It's no wonder it's also feeling a little bit confusing. Treatment is disrupted. So many people found that the diabetes, at least in the early stages when they were just getting to grips with it, can be disruptive to daily life. And again, in adolescence, there is already so much change for you to be getting to grips with. So again, it's no surprise that all these new additional things on top can feel like they're just getting in the way of it. Why me? More than 2/3 of the people we asked admitted to asking that question. Why did diabetes happen to me? Why me, and why not all of my friends? Why do all my friends have to get to go through life and they don't have to worry about this? This isn't fair. And I'm sure that some of you who are watching this webinar will be able to relate to that feeling too. I'm feeling sad, linked to that last slide, feeling sad or angry about diabetes, as if life isn't already hard enough. Diabetes just comes along and gets involved. 23 out of 31 people we asked said they felt sad or angry about having diabetes. These are really normal emotions. And the most common response was people wondering what would happen to their lives in the future. Again, this is new, it's different, it's something that it can take time to get to grips with and for it to sink in and make sense of, and it can feel like a whirlwind in the beginning, and you'll be wondering and uncertain about what this means for the future, but there will be lots of people around you to help you to make sense of that and also answer any questions that you have. Some of the other common responses: not wanting to do something because of diabetes, not wanting or just can't be bothered with diabetes, feeling worried or self-conscious about other people finding out about it and needing to explain, feeling upset or fearful about being in hospital, thinking, oh, I've got a lot to learn, and wondering if there was any way that diabetes could be prevented, or if there's someone to blame. Whose fault is it? And that's something we all do when things happen in our lives that go wrong sometimes. We try and work out whether there's anything that could have been done to avoid it. And not believing that you have diabetes, or thinking and hoping even that it might go away. So, understandably, a lot of people feel like this. They don't want it, and they wish it never appeared, and their lives would feel a lot easier, at least initially, if it just didn't happen. And also, it provokes a lot of worry. A lot of people worry that there's a lot to think about, there's a lot to learn, and they feel uncertain and confused about how it's going to affect their lives. Now I'm going to hand you over to Mel, who's going to explain this very colourful slide.
Thanks, Craig. You talked about how many worries there are, and the kinds of things that people were talking about. And we asked the question, are there any fears that you had that didn't come true? And the people that we asked, they gave us their kind of ideas of the things that they were worried about that didn't come true. And these were the most common things and some examples of what they've said. But one of the really common fears was that they wouldn't be able to ever manage their diabetes, that it was too complicated, or it was too much in some ways. They couldn't get used to the idea of some of these things, couldn't get over the worries they had about talking to people, some of the other things that they were concerned about. But what someone said to us was, I was worried that I couldn't be able to look after my diabetes, like carb counting and working out my blood sugars. But we're doing now, I've got used to it. We're doing it fine. So another thing was, my life will never be normal again. And someone said, I found out I could still do all the activities that my friends could, and I could still eat my favourite food. They told us that they were worried that people would judge them for having diabetes or be unkind about diabetes. I found out that it wasn't such a big deal letting my friends know, is what they said. Someone worried that treatment would always be difficult and painful, and they told us treatment doesn't hurt anymore. And another common worry is that I was worried about being really ill and having to go to hospital again. But someone said being hospitalised with several hypos didn't happen. So they told us a bit. They gave us some advice about what to tell you to make diabetes work for them, how they adjusted, the things that were really useful for them. So this is the advice they gave you. Take care of yourself. How to make this work. Take care of yourself. They said, don't give up or ignore it. It gets easier if you follow your treatment. Be who you are and don't hold back on your life. So that's, you know, sometimes we feel like there's a lot of things that have changed. We're going to have to change everything about our lives. But actually, over time, what we find out is how it fits in alongside all the other things that were already there, and how we can learn how to adjust and get on with the stuff we always enjoyed and the things that we always wanted to do, but with diabetes alongside. It's not your fault. This was a really big theme. You didn't do anything wrong. Diabetes didn't happen to you because you did anything wrong. And it's important that you find out what works for you. The other thing they said was know your stuff. So they said make plans, develop routines and get organised. That really helped them to make it work. Talk to people about diabetes and help them understand what you have to do. That can be really hard to do. And if you feel worried about that, that's something the diabetes team and we can help you with. But it seems like it's really important to helping make diabetes work for you. Be patient and try not to be perfect. It takes time. So they're telling us from their experience of having diabetes for more than 3 years now, it takes a little bit of time to start with. It feels big and confusing, but they kind of worked it out eventually. So another thing that made it work was reaching out, taking advice and getting some help when you needed it. Connect with other people who have diabetes and be open about your worries and things that you feel that you're uncertain about. And the other big thing is eating. So diabetes is all about eating for a lot of people. So consider using technology. Big thing was carb counting is really important. It's worth all the time it takes for you to learn how to do this easily. But it gets easier. And they all said, you don't have to miss out on your favourite food. You can eat what you enjoy. You just got to learn what it does so that you can manage it and still enjoy the foods that you like. So essentially, diabetes doesn't define you. It's not who you are. It's just a big thing that you need to think about and learn about to start with. But it does become something that you get more used to, you get more skillful at, and it becomes a part of the bigger picture of your life. So essentially, because you're learning how to manage something that your body used to do on its own, it's going to take some time before you learn and have all the knowledge and skills that you need to do that. All of the respondents told us they found it easier after a while. What they told us really helped was the diabetes team support to start with. Some of them even said that clinics were really helpful. Meeting other people with diabetes was actually one of the biggest responses. So at some point in the future, we'd like to find ways to help you all get together so that you can talk to each other about your experiences of finding your way and making it work. Finding information online, searching for different things, different apps, getting all that information that helps you understand what's going on. Using technology, that was a big one. So if you're thinking about a pump or a Libra or an app or similar kinds of devices that help you manage and remember to do what you need to do when you need to do it, they're highly recommended. The other thing that came highly recommended was the carbs and calories bit. So Carb Counting and the books and apps that go with that, and any other education resources, they really said this is really helpful for you. They also had some really specific advice that I didn't want to miss out. So, for example, you can get a disabled fast pass if you go to an amusement park, so you don't have to wait in the long queue. They suggested that you make a book or an app with the meals that you really like that are already carb counted because it makes it quicker. And they said that the Carbon Cows app is better than the book. The pictures are better. So you've had some kind of ideas and the information and advice that they've given you. I thought now might be a good time to sort of pause and see if there are any questions or any things that has been going on in the Q&A at the moment, and see if there's anything that Sarah has to feedback or tell us about.
Thanks, Mel. We haven't got any questions at the moment that anybody would like to bring forward, so we can have another check back at the end of the session.
Okay, so it's back to me. Hopefully you can see me and the slides on the screen at the moment. So the next thing we want to talk about is how we, as psychologists, can help. And we're obviously psychologists as part of the paediatric psychology team, and work really closely with the diabetes team. We offer support with managing difficult feelings about having diabetes. It's not about making diabetes or these feelings that come along with it go away, because having feelings and emotions is normal. But what we provide is an opportunity to talk about it, to make sense of what's going on with these thoughts and these feelings, and see if we can help you work out what's making it really difficult, and what might be getting in the way of you feeling like you're on top of this, and help you to make it work. We can support worries about how diabetes might be affecting your life at school, with your families and friends. Think about what's going to change. It affects everyone differently, but as you've seen in some of these earlier slides, the worries that people have about diabetes and what their life is going to be like, they're very much similar. You know, people have the same concerns about talking to people, about how they're going to explain it, about the worries about what's going to happen in their future in terms of where they're going to end up, and if it's going to get in the way. That's absolutely something we can think about, especially in the context of thinking about your friends and your family. We can offer help and advice about how you can talk to other people with about your diabetes, and that's really something that again can vary, and it might be as simple as helping you to develop a script, so a way in which you can share with other people as much as you'd like to without needing to talk about it in lots of depth. And some people find it really easy and actually enjoy talking and educating others about it, whereas some people actually try to avoid people asking lots of questions. And we can obviously think about that with you too. We can support you if you're feeling a bit off track with your diabetes care. You know, with anything in life, there are slip-ups. With anything new and big, with a lot to learn and to take on board, it can be really difficult to manage early on, and even late on. Life gets in the way. You know, things will happen in your life which mean that your management of the diabetes gets a bit skew-if, and that's okay too. And if there are ways that we can help you to make sense of that and help and support you in line with the diabetes team as well, then obviously that's something we're obviously willing to do. We can help you to feel more in control of your diabetes. So again, it's another common feeling that people have when this diabetes comes along. It can feel like there's something that kind of you've got to manage, and it can at times feel like it's controlling you. And of course, that's something that we can help you to understand, to make sense of, and see if there are ways that you can control you can take back control. Okay, and it's more about how you can live well alongside your diabetes without it preventing you from doing the things that really matter to you. We can support you to cope with treatments that you might be worried about. Obviously, for many of you, it will probably be the very first time that you've had to self-administer anything and any medication, and also it's a lot to take on. So we have lots of ways that we can help you to manage the worry or the stress or the anxiety that may come along with that. And we can think about how your family, friends and the diabetes team can best support you. So we work really closely with those, and we're always willing to support families and other people and friends to see, actually, you're going to be around them far more than you see us. So really, they're the people that you ideally want to be able to talk to and feel supported by. So we're obviously really, really keen to help you to understand how we can support them to support you. And the next thing is the same, is helping the diabetes team help you. So they have lots of responsibility in terms of what they're supporting you to manage, and we can join in and jump in and help them think about some of the complex stuff that's going on, and any way that we can help. Is just some common advice. So we can't stress this enough. So try and make your management of diabetes as simple as possible. So something we all do in life, and to different degrees, but we all will try to do things perfectly, okay, at different times. But realistically, you're learning something, a skill, as Mel described earlier, that your body has been doing without you really having to ever think about it, and you've got to learn. You don't expect to pick up a musical instrument and be able to play it perfectly. You have to just aim to be good enough, and just take some of the pressure off you. Have your kit where you need it, so keep it within reach, keep it somewhere you are able to find it, and not leaving it somewhere else where actually it's not going to be easy to get to. Know who your support is and how to get their help. So there are obviously lots of people you're able to talk to, and it's really helpful to just have a think about and try and identify who the best people are to talk to, and who you feel most supported by, and how you go about accessing them. And we'll obviously have some links and some phone numbers to people that are, or services outside of your network that also can offer this. Think of ways to tell people about your diabetes if they need to know. And this might include school, for example. Practice on people you trust first. And as I said earlier, maybe you want to go into lots of detail, or you want to just tell people just enough so they're aware that this is something you've got to manage and this is something that's on your mind. Learn mindfulness or body awareness. Okay, and there are lots and lots of ways that you can do this, from apps to classes to doing it through sessions, through psychology interventions. You know, these are really beneficial because they can help you recognize changes in your blood glucose in your body. They can help notice how you feel emotionally. It's about tuning into what those emotions are, and it can help tame worries and solve problems and help you be more aware of what you're doing, which again links to you having more freedom and more control over your aspects of your life that you may feel that diabetes gets in the way of. Talk to someone about how you feel. This can help you solve things, feel supported, and get help when you need it. And tame worries. So we all have worries. It's human. We worry about things, and that's normal because we're trying to make sense of things. But diabetes management is just another layer of things that makes them more likely to happen.
This is a worry cycle. So diabetes management can move us a bit more into what can be quite a tricky cycle of worrying that can sort of go round and round and round. So I wanted to talk you through it because some of you might recognise this is happening already. So what's most common, I think, is for people to worry that their blood glucose is going low, and to worry about the impact of that, because obviously it can be bad. So what they might do is worry about their going low. So they feel worried. They might notice in their body that they're shaking, or they're hot, or they're worried, or they've got butterflies in their tummy, or they've got lots of thoughts that feel really scary. And they want to do something about that because it doesn't feel very nice. So in this example, what they might do is check their blood glucose. So that would be to get some reassurance. They might think, oh no, maybe my blood glucose is low, I better check. And then they go, oh, thank goodness, I remember, I know what it is that's happening in my body now. I've checked my blood glucose. And they either feel a lot better because they checked it and it's okay, or they might notice that their blood glucose is a bit high or it's a bit low. They go, oh goodness, it's much more variable than I thought it was. This is much more scary. And then this other worry comes in. Well, maybe there's a lot more lows and a lot more highs than I thought there was. Maybe I need to check even more. And that might lead to feeling like I can't control this, or this is really dangerous. I need to check loads. And then that goes round again. Another worrying thought, another worrying feeling. The important thing to remember here is what started this off was a worrying thought or feeling, not the fact that our blood glucose was low. So if you feel into your body and you go, oh, I'm feeling a bit tired or a bit confused, that might be a really good sign that your blood glucose is low, and you should definitely check that. But if what you're feeling is worry, what we're doing then is we're checking something because we're worried. But what we're not doing is noticing what the facts are. So the facts are that your blood glucose goes up and down all the time. And when we check, what we do is we notice that happen more. But we might think that that's a problem. What can then happen is we end up checking more and more and more. And it just becomes a really big deal that we're dealing with all the time and we feel worried about. And that's just one example. Because the other way this goes is someone has a worrying thought and they feel a little bit overwhelmed and upset about it. And they just don't want to think about it at all. And then they feel a bit better because they just pushed it out of their mind. But then the worrying thought comes back again. Maybe they're worried that they can't manage. And then when they notice that their blood glucose is all over the place, or they get to clinic and things aren't the way that they'd like it to be when they go and share their results with the team, they might have lots of thoughts and feelings like, I can't control this. I can't manage my diabetes. I feel bad about this. I really wish this wasn't happening. And then that fuels more worried thoughts and feelings. So this is a cycle that's very easy to get into with diabetes, because we do need to check, because there are important things to check. But sometimes we can check too much or not enough because we're basing it on worried feelings that we're having. So if you do notice that this is happening, one of the really useful things we can do is notice that we're feeling worried and ask ourselves, are we responding to the facts or are we responding to feelings of worry? If we're responding to feelings of worry, don't change anything that you're doing, just respond to the facts. Respond to your blood glucose levels, do what you need to do, or get some advice if you're not sure. Phone the diabetes team or check your monitor for the advice that it gives you. And if you stick to that for a while, you'll notice that this cycle gets smaller and kind of stops. If you notice that's happened to you and you feel like it's a bit out of control, you can talk to someone in the diabetes team and we can talk about it a bit more. But if you notice that you just got generally some worries, and I'm going to offer you some few ideas now about taming worries. These are just really good ways of dealing with any kind of worries or anxiety or stress in your life. And they work for adults as well as young people. So any family members on the call as well today, you can use these too. One thing that's really important is when we've identified that we're dealing with a worry, it's really important to check the facts. Is this worry likely to be as dangerous as I'm worried it's going to be? Well, what we can do then is be brave and we can find out how dangerous it is. Check with someone who you trust to see if they think that's a good idea. And then you can try it out and find out what the reality is of your worry. You can talk to others about it. That's a really good way. Learn ways of just kind of keeping yourself feeling on an even keel, feeling kind of chilled and relaxed. So those can be all kinds of different things for you. And I've got some other ideas if that's important and you want to learn some things about that. Getting enough sleep's really important. That's just really good for everything. If you have trouble with sleep, ask someone at the diabetes team. You can look it up online. There's loads of really good apps, resources, and I can give you some really good advice on that as well. Look things up, get some information. If you're not sure about something, ask. Don't sort of think, oh, I should know about this. I'm sure they told me about this once before. We quite often have to tell people things, all kinds of different things over and over again. We can't remember everything all the time. If you find yourself getting panicky, it might be really useful to identify what kinds of strategies help you feel calm and safe. So that might be with a teacher, you might find a way of being able to move to a different part of the classroom or school, or that might be at home where you've got people you can go to or a place you can go to where you feel a bit more comfortable and safe while you deal with that extra, panic or worry. But what's most important is to have fun, do some activities and get some exercise, do some things, move around. But enjoy the stuff that you do. Do things that are important to you. You don't have to stop doing anything because of diabetes. We just need to find a way of managing it. So if then we think about, when would we get help? When do we need to get help? So I would say get help when things are getting way too much, where it feels like it's more than you can handle, and it's when you're avoiding things that you need to do, if you feel too worried or too sad, so if it feels a bit more than usual, if your usual solutions that you've tried before don't seem to work for you and you think you might need some help to come up with some new ones, or if you really feel like you're on your own or nobody could possibly understand, I guarantee that we can understand it with you and we can find out some ways to make it feel a bit different. So if you want to get help, don't wait, ask someone, talk to someone, whoever you trust. So talk to someone that you trust and tell them how you're feeling. Maybe have a think now. Are there 3 people you trust? Identify who they are. Who are the people who you'd go to if you felt you needed some help? You can always speak to someone in the diabetes team. So there's all the nurses and the doctors and the dietitians and the other people in the team who you see on a regular basis. Maybe you want to save the diabetes team phone number in your phone so that you can get in contact with them easily. So you can ask also the people in the diabetes team to speak to a psychologist if you want to, if you think there's stuff that we can offer you that'd be really helpful. If you feel like you need some urgent advice, like you're really worried, really sad, you're concerned and you can't wait, phone the CAMS consultation line. It's open 24/7 and you can phone it on that number. It's 0300 1111 022 or Childline, and the number's given there. So we've gone through quite a lot of different bits of information, but most people told us that it gets easier. And we hope that this advice and this information helps you to find your way to make diabetes work for you. So I'm just going to pause there. I want to see if there are any questions.